Hello, everyone, and welcome to Scrubbed In and Speaking Out. I'm Yvette Coffey, President of the Registered Nurses Union, Newfoundland and Labrador. So we're right in the middle of a 2025 provincial election campaign, and we've invited each of the party leaders to join us and speak directly to you, our members and the public, about their vision for nursing and for public healthcare in Newfoundland and Labrador. So today I'm joined by Tony Wakeham from the PC Party. Welcome, Tony. Thank you so much for being here. We really appreciate you taking the time to talk to us about this very important topic. So let's start. What is your party's vision for not only nursing, but for the public healthcare system in Newfoundland and Labrador?
Absolutely. I think one of the things that I have over other candidates that are running, the other leaders of the other parties, is I've lived and worked in healthcare all my life. I spent most of my career in healthcare, and I was one of the fortunate ones that was able to stay here in the province of Newfoundland and Labrador. And I've worked in places like Clarenville and Grand Falls and Labrador, and even in the department. So I've seen firsthand the challenges with healthcare. But I also know now, after 10 years, of Liberal government, we find ourselves ranked with the worst healthcare system in Canada. But what upsets me the most is when solutions are brought forward by our union members, the Nurses Union, AQP, AHP, and others. They're often ignored. And I think about this situation with the Nurses Union in particular, when you will go out and talk about the number of vacancies or new grads, and instead of sitting down with you to talk about, okay, how do we arrive at the number, they argue with you over how the number was arrived at. Mm-hmm. So let's be clear. We have a problem in Newfoundland and Labrador. We have not changed our staffing models in years. In our acute care system, we know once upon a time you recovered in hospital. Mm-hmm. These days you don't. Nope. You are in and out, and that acuity level has gone up significantly. So our nurses, our frontline workers are being asked to be always on the move. That's the challenge with higher acuity levels. And if you don't address the staffing model, then we are leaving too many people are falling between the cracks. And it's the same in long-term care. Mm-hmm. You and I can remember a time when people walked in with their suitcases. They were really personal care homes, that what we had called the day, more level 1 and 2. Mm-hmm. Today, level 3, level 4. Again, the requirement for staffing, the requirement of that level of care has gone up, but we have failed our staff by not turning around and taking seriously the concerns around how we actually staff. And what we ought to be doing is not turning around and simply talking about what we're going to do. I would have thought 10 years, Liberal government would have had it done by now.
Your point is well taken, and you've heard me talk about that. You have knee surgery 20 odd years ago, and you were in for 2 weeks. Now that's outpatient. And it used to be, with nursing, you had the ability, some of your patients were fresh from surgery, some were recovering, they're in the week 1 and week 2. So you didn't have a heavy patient load with every single patient that you had. But today, to your point, every single patient has a very high acuity level and needs the care. So you've heard me talk about safe staffing levels, increased workloads, the mandatory overtime, upwards of 24-hour shifts. And we've been talking now about safe patient ratios, so nurse-to-patient ratios, but also safe hours of care. And I'd like to get your thoughts on that and where your party thinks we should go when it comes to safe hours of care, addressing all these issues in the workplace, because this is the retention issues that I keep talking about. And we're never going to retain people while the workplace remains the same.
I mean, our goal has to be that mandatory workload has to be eliminated. Mm-hmm. Now, I recognize that will take time, but that starts with recognizing that we have that problem, recognizing that we have to increase our staffing levels. We have to start listening to the people on the front lines. It's as simple as that. I have said everywhere I've gone in this election that if you really want to fix healthcare, it's not about doing another study. It's about going out and talking to the people that work in the system. They have solutions. Those solutions are not always about money. Those solutions about how they could do things differently. And the cookie cutter approach doesn't work, because different parts of our province may need different solutions. But the only way you get that is by the actual communication piece. And that's what's so frustrating. So for me, this idea of having these reviews done, if they haven't been done, they ought to have been done, and we will get them done for sure. And if they have been done, they need to be implemented. And let's not be arguing about whether or not you say you've got this many vacancies or the government says you got that many vacancies. Fact of the matter is there's vacancies. What's the actual plan we're going to do it? And that's why I've committed to turning around and saying that if you're in nursing school right now, I will go in and recruit you in year 1, not in year 4. I want to recruit you on your way into your program, not on your way out. Now, I want to be able to offer you a full-time job. And you know how I'm going to do that? Because I'm going to develop those relationships with all of our nursing students. It's not about a one-time thing. You have to go in and you have to talk to students when they enter the program, and you have to work with them through the program. What is it you would like to practice? What area would you like to practice? Where would you like to practice? What does it look like for you? Those are conversations that we ought to be having, and currently we're not having.
So I will say that, every time we talk about that and hiring all new graduates, and I believe your party has come out too and talked about paid clinical placements for nursing students. I often say we are a predominantly female workforce, and I do link that to a lot of things that go on in healthcare system. Equal pay for equal work. We have some of our members who work in community that we call our poor cousins in our system. We tried at transition talks, we tried at the last round of bargaining to get rid of what's called flex time in community, so they don't get the overtime premiums that long-term care nurses or acute care nurses get. And we've already said, this round of bargaining coming up, we will hit the streets over that, because that's not right. Why should they not get the same pay that I got when I worked in ICU? Right, for coming in on my day off or my evening off. So nurse practitioners is a big thing, and I've heard you talk about them as well. We now have a funding model, a pilot, that's happening out there for the private nurse practitioners so that people are not paying out of pocket. What are your party's views on making sure that that is a permanent model and not just a pilot that will need to be evaluated over and over again?
We have publicly stated that our model and what we do will be a permanent model, not simply a model that we're setting up with a limited time frame to see how it works. Look, nurse practitioners play such a valuable role in our healthcare system. I see a nurse practitioner. That's exactly what we do. They are a primary care provider. Now, how they want to practice. Some may want to practice in acute care. Some may want to practice in long-term care. Some may want to practice in the community. Some may want to turn around and practice in public health. Mm-hmm. But let's make sure that we give them the options. And let's make sure we set up a model that works for all. That's why I've also announced that I will double the size of the nurse practitioner program. I know it will take time, but I am committed to doing that. I'm committed to adding 50 more seats to the nursing school program, because for me, it's always about two things. One, keeping our own, and then making sure we recruit our own. Mm-hmm. And that is the other reason why you saw on our platform where we turned around and announced our tuition change. So in other words, if you go to college or university here and you graduate, that we will turn around and give you your tuition back if you file your income tax in Newfoundland and Labrador. We want people to stay here. I want to incentivize them to stay here over and above all of the other things that may be negotiated. But it's the concept of, if you stay and file your income tax in Newfoundland and Labrador, we're going to give you back your tuition. I want our young people to stay here. That's the success we will have. So
as I said, we're going to collective bargaining next year. And we are, we're looking to enter into good faith bargaining, and want to ensure that whoever is in power at the time enters as well. We have a lot of issues that we struggle with every single day. And when I talk about equal pay for equal work, I talk about a nurse educator or let's say a diabetic educator, nurse educator in St. John's is making a different rate of pay than a diabetic educator in Central. Or the chemotherapy nurse in Clarenville gets paid less than the nurse who's giving chemotherapy in St. John's or Gander or Grand Falls because they're under the Eastern Health model, which you would think Clarenville would be as well. But everyone says, oh, not my issue. That's the job classification system. What's your solution to that? Because I know you've heard about it. You've heard me talk about it.
I've heard you talk about it. I had that same thing happen in my own district in Stephenville and Sir Thomas Roddick Hospital. I think it's, I don't understand it. When a patient leaves St. John's, they're cared for. When they come out in one of our rural locations, they're cared for. There's no difference. So at the end of the day, this double standard is what causes us to not be able to retain. It causes us not to be able to recruit. So this elimination of all these double standards has to happen. We can't keep doing that to ourselves. And I find it very frustrating that we hear all of these stories all the time. But I'm also concerned, too, about the level of autonomy in local regions, especially outside of the big city. We've got a regional One Health Authority now. But what does that mean to people on the ground? Because I've heard so many complaints about frontline staff not knowing who to go to, not knowing how to get answers for things that they have, and solutions that are right there in front of them, but they can't find anybody that can say, yes, let's do this. It seems like everything has all slowed down because of bureaucracy that we've created. And I find it ironic that the solution that the Liberals have put forward is to create another bureaucracy, to say now we're going to have more bureaucracy to recruit and retain, when we all know that the solutions are there already. We don't need to go and have more reports or more studies done.
I will agree with you on that piece. When Hogan, Premier Hogan, when he was in the Premier seat, he said to me, what is it you want, Yvette? Do you want us to move faster? I'm like, yeah, that's what I want. I'm done with bureaucracy. I'm done with talking about things. I'm action orientated. When I say this needs to be done, it needs to be done. I will ask, and I've asked each party this, your commitment to continue with the public inquiry into the private agency contracts. And I'm not just talking about nursing private agency. The Auditor General was also looking into like Teladoc and all of these contracts with private companies outside of Newfoundland and Labrador that are making money off Newfoundland and Labrador. But a commitment that inquiry by the public inquiry, the commission will continue.
We have said that publicly in the House of Assembly and on record of saying that. We have all seen what happens when you don't go out for a request for proposals or don't engage with people when you enter into these contracts. Instead, these are sole source contracts. One with the travel nurses started with a call to the Premier's office, wound up with a call to Central Health, sole source to a company who had no travel nurses under their company at the time, and turned around and signed off by the Minister of Health of today to go ahead and do this. And this is what happens when we do that. We wind up paying out the highest travel nurses contract in the entire country. Now, what we have now is we have a solution being put forward by your union as to how we can turn around and address those issues. And that's something I'm committed to doing too, because I think that's a practical solution. As we know, we will need time to gear up and fill all of our vacant positions. But what you are proposing in your thing is a practical way to make sure that rural Newfoundland and Labrador is looked after.
So you're talking about our travel locum. Okay, so we've just signed another agreement for Central Newfoundland with $15 an hour because, of course, we always recognize that we cannot disadvantage Labrador. It's a lot harder to get on an airplane and go to Nain, work for 2 weeks than it is to drive to Carbonear for 2 weeks from St. John's, right? So always cognizant of that, and not, and it's not just Labrador; it's the great Northern Peninsula. But the travel locum, it's that bureaucracy that really gets me. But for me, we need to expand that entire travel locum that we had in Labrador to the whole province, because right now we are utilizing private agency nurses in every nook and cranny. And as we've traveled around the province, we've seen that. When I have family in hospital, I go to the Health Science or St. Clair's. There's travel nurses there. So it's not just urban, it's not just rural and remote areas, it's also urban. So when we go into collective bargaining next year, I guess we're looking for a commitment that if you form government, that it will be good faith bargaining, and that the issues and concerns that we are bringing forward from our members and the solutions, as you've said, from our members, that there will be a very good conversation and actions coming out of those conversations. Nurses in Newfoundland and Labrador should not feel second best, because we provide excellent care, healthcare in this province. You've been an administrator in healthcare. And we have to get to a point where we retain, because what we're doing is bleeding nurses out of this province. The graduating class is just going off to, Nova Scotia has hired every single nurse that applied over there, every single one, and let them work wherever they want it. And I'm glad to hear that commitment from you as well. But I also think we need to be looking at the education piece too. And one of the things that government has a briefing note on is the amalgamation of schools of nursing. And I have not heard anybody talk about that at this point. So I know I just threw that one on you, so I'll get you to think about that one and percolate. You might want to come back to me. But I will say, I'm glad to hear you talk about nurse practitioners and that you have one. Yes. Because I understand that they give awesome care. And like our campaign says, there is an NP for that. But I want to thank you so much for coming in and taking time out of your busy campaign. We know it's busy around the road to talk to us, but to talk to registered nurses, nurse practitioners, and the public. Because if healthcare is not number one issue in this election, it should be. It ought to be.
In our platform and what we're hearing at the doors, it is the number one issue in this election, despite others trying to make it about something else. Absolutely. Healthcare is number one. And I could tell you stories that the same as you have heard all over the province of Newfoundland and Labrador, people who have been left behind, nurses who are feeling burnt out. They don't get the rest that once upon a time they get. And this idea of mandatory requirements, working 18 hours and being called back, in some cases 24 hours. We've got to find solutions. And the only way we do that is we sit down and we work and come up with a solution together. And that's exactly what I'm committed to doing.
All right, you've heard it here. So to our listeners, you can find each of the parties' responses to our questions that nurses are asking and the public on our website at rnunl.ca. I'm Yvette Coffey with the Registered Nurses Union, Newfoundland and Labrador. Thank you for tuning in to Scrubbed In and Speaking Out.